why is it not working? You know, why is my body not working? But we know inherently it's going to heal, it will regulate, it just needs the correct nerve supply, the correct environment, the correct things in place, and then it will start to work. But it can feel like when you've been in a place for so long, that's not the case. So it's just having someone that can help you through that process and change your perspective on it a little bit, give you the confidence that your body will do that as well, and then execute it and then deliver the correct correction at the right time.
Well, I had a question about this as well, and I don't know if it's just a bit too conceptual, but because I had a kind of real journey with that element, with the trust in my body, because I think I can see now that at the beginning I was putting all my trust in each adjustment and then being quite obsessive about like ruining the adjustment, or like, and so it was both kind of, oh, I need to like keep this adjustment and hold it in place kind of thing, which was probably just counterproductive because I was tense. But then it was also like I didn't really see that anything else might help as well. So it was like, only these adjustments will save me kind of thing. So although it was like a natural treatment, I was still not really trusting my body, if that makes sense. I was just outsourcing all of it to the chiropractic care. So I don't know if you have thoughts about that, or if you see that often, especially with dizzy patients. And then on a related note, like, do you see that there are other things that the patients need to be doing, you know, not just relying on the adjustment?
Yeah, definitely. So well, the way that I look at your health, and maybe something that I don't know if you've looked at it, is you've got a salutogenic approach to health. And that means that health isn't like X or Y. It's not like a static point, but it's on a continuum, right? And there's many things that can add to that. And chiropractic care is one, and it's great because it sets a foundation with how well your nervous system works. And that's what controls all the functions of your body. So as a foundation, chiropractic does work really well. And that's why people can get really hung up on it and put a lot of trust in it. But definitely when people are proactive with looking at their diet, making sure they're hydrated well, and making sure that they exercise, making sure they get enough rest. Like, sleep is massive when people are just sleep deprived. That's huge, you know. So if you look at all those little, like I say, it's like a multifaceted approach. And I can give you the foundation of chiropractic care and a healthy nervous system. You need to go away and make sure that you're eating the right things. If you want to, like, I usually just make more fruit and vegetables, fresh things, whole foods is important. The less processed stuff, the better. Things that you don't know the names of on the packaging, stay away from. Really easy nutrition. Making sure you're hydrated, making sure that you get out when you move, because a lot of people will be like, they'll get adjusted and then they'll move and they'll just be tense. Like, I don't want to move my neck. You also need to have a little bit of movement in your neck, because all those, so you need a little bit of movement because your neck gives information back to your brain. So if you stay tensed all the time, you just, you become, it's fine striking the balance, right? So there's lots of things, like, but sleep, exercise, water, nutrition, they're big pillars for people. And when people take those on, as well as chiropractic care, results are way better.
Because I've personally found that, like, looking at the mental, emotional side of things was really necessary to then get out of that loop of being adjusted, feeling better, then feeling really bad again, then needing another adjustment. And it, like, I wasn't really coming out of that as quickly as maybe I would have done if I'd at the time. So something that I and a lot of people in the kind of Instagram community I've seen have found really useful is the rock steady approach by Joey Remigny, and that's all about neuroplasticity. And I think she, you know, people who take her courses and things or use her resources see such great results, and they're not even getting adjusted. So that kind of said to me, there are so many different ways that you might be able to get this this outcome. So maybe we should talk now about the neuroplasticity question.
So in terms of what happens in terms of your spine, you can think of it as like safety pin cycle or something. You've got your brain communicating information out to your body, and then your body getting information back up to your brain. And when we look at these joints here, these are so densely populated with what we call mechanoreceptors, and they're all giving constant feedback about the position of your head in space back up to your brain. If you have a misalignment up there and either out of position or stuck in the wrong position, your brain then constantly starts to get like this incorrect feedback. And if that is, that we constantly give it that information, then what we wire in is, this is where my head is in space, and this is the wrong feedback. This isn't where it should be. And then we've got this disconnect. What's the word? Incongruency, if you like. It thinks your head should be in one place, and it's actually getting feedback that it's in the other place. This is when people start to get what we like the cervicogenic dizziness aspect of things. So then what we'll do, that when we have a misalignment, it can often come with a lack of motion as well. So just like you were tense, you need movement, otherwise the brain isn't getting that information that it needs. So when we make a correction, you'll get the correction in the alignment, you'll get the improved motion at that joint as well. And then it's about, you'll start to get different information back up to your brain. That neuroplasticity, that'll start to change. There's all sorts of other things you can do in terms of neuroplasticity, and it's really big. But it's not necessarily something I'm an expert in, but you can do all sorts of things, moving your eyes and vestibular retraining. They're all, if you like, neuroplasticity training in term, just under a different umbrella and under a different name. So there's a lot of different things, but the thing that I really get from it is that your brain is so intelligent, and it can adapt, and it can mold, and it can change, which is great, which gives us a chance, gives us the chance. If it wasn't able to do that, then we'd be like, okay, well, it's there, we can't undo it, it can't change. But the fact that it can change and it has that plasticity means that it's a really positive platform to build on.
Yeah, that's just that little piece of hope, isn't it, that you often don't have when you're, I mean, obviously people do get sent for vestibular rehabilitation therapy, VRT and things like that. And so there is that kind of that message of like, we might be able to change this. But I personally feel like I hadn't seen as much of a hopeful message from anything else until I was in the chiropractic office, and it was like, yeah, you can change this. This can all be undone or, resolved. Because I think there is often a bit of an idea of like, well, if it hasn't healed in a few months, it's probably never going to, which is just like soul destroying. And then again, that's the message your brain's getting again and again, so that it's going to keep feeling those things. It's going to stay stuck in that state. So literally just the mindset of being given the hope can be so powerful as well.
Yeah, and it's interesting because as chiropractors, we have this real appreciation for your body's ability to heal itself. And that is literally what we pin our full practice on. Like, your body is an intelligent organism. It can heal itself given the correct environment. And all we want to do is remove the interference. So your body can start to express itself, because we know that your body's built to be healthy. It's not built to break down. And we just want to make sure that that environment is in the right place, so your body can communicate, it can have the ability to be healthy. Which is why the care that we give for people with vestibular problems is the same for the people that we see with migraines, because all we're doing is removing the interference and trusting that the body will start to heal and it'll start to function at a better level. So it's not, we don't treat these things differently. We don't treat these things at all, all we do is remove the interference, and we watch the body start to regulate and heal. Yeah, exactly. So it's not a treatment for any of these things really, but what it is it's like one of those things that you can add to your, I would say, your pot of things, which is going to improve your health, and put your body in the correct environment so that it can start to heal and it can start to regulate, which is it's a different concept. Not many professions have that concept, which is probably why you come into a chiropractic office, and then after working in the chiropractic clinic as well, you just get this like buzz, like when people come in. If we find a problem in there, we're confident we can help them.
No, definitely. I guess I'm wondering, I don't know if other people will be wondering, but I have often thought about this. If your body, can naturally heal itself, why did it need someone trained in a discipline that didn't even used to exist to put that input in, if you see what I mean? And I'm guessing it might
Yeah.
be because our modern lifestyles are quite bad for our spine, so maybe it wouldn't have been so needed before. Is that, what do you think?
Hmm. Well, I think we've always had people who have been sick, you know, and people that have got sick for no real apparent reason, you know. And this full profession, uh, one of the first quotes from the founder is, why would two men be sat at the same table, with basically with the same lifestyle? One would be sick, one would be ill, and
Mm.
one wouldn't be. One would be sick, one would be well. Sorry, like why? What's the difference in people? So I think the more we research and the more we look at the human body, we sort of recognize, and the people who founded and developed chiropractic realized, well, this top part of your neck is the most mobile part of the spine. And when you've got something that's so mobile, it becomes less stable. And when that becomes less stable, we have the potential for that to misalign and become out of position. And what is the impact of this on the body? Well, now we know it's huge impact on people's lives. So I think it's probably always going on. But nowadays, yeah, we put our body through its paces. We sit like this. We, yeah, we want to drive cars. We want to drive them not to 60 in 2 seconds. We want to go places. We want to do everything to the extreme, which is then when we look at our bodies, why does our body then start to break down? We do everything to the extreme nowadays. We didn't used to do that. How's our diet? How's our lifestyle? We're always like, I think our diet now and the food that we eat, is it as nutritious as it was? Is
Yeah.
it covered in more chemicals or less chemicals? Are we exposed to stresses from all sorts of things all the time? Our body's under so much more stress, which is probably why we're seeing prevalence of these things going up and up, you know?
Mm.
So it's not that I think, yeah, it's not. It's like what you said. Like, when would you stop coming in to
Mm.
see the chiropractor? Well, when you can be confident that your body's like you're not putting it under too much stress, and that you. I don't think we're ever going to be in that point as a human race, because we, as human nature, it is always push your body to the limits, and um, yeah,
Yeah. And I just wanted to clarify as well from a few topics ago. Is there any scenario in which someone couldn't come to you for care, or is there anything you can't do alongside the care? So, like, obviously, people are on medications, doing VRT, acupuncture, and things like that. Are
yeah.
there contraindications to what you do?
Yeah, there are contraindications, and they're more like, but we will look at those in terms of in our analysis. I mean, if there's pathology and stuff up there, then we're probably not going to be going in and being working on that. If people have had surgery up there, it can be a bit more difficult to work with. It's not that we can't. If there's huge like instability in there, which in the vestibular world, a lot of people sort of end up at the conclusion that it must be cervical instability. You know, what's the abbreviation for it?
I can't remember.
Yeah, like I don't know if it's CIS or something, but yeah, if there's a huge instability up there, then if we're correcting things in the misalignment all the time, then we have to draw like uh, medium, like, is this going to work? But it's not like, it's not any particular conditions mean you can come in or you can't come in. It's not like, if you've got this condition, it means that you can't come in, or if you've got this one, it means it'll work well. That was the first part. There was another part of that question as well. I
um,
forgot.
it was, can you do it alongside other things? So, say if someone was having
Yeah,
physio or VRT or was on medications.
yeah. I think it works as well, if not better, if people are doing other things with to help themselves. So I just usually say stick to one type of chiropractic. So
Yeah.
if someone's working on your spine, make sure you go got one person working on your spine. But in terms of muscle work, I work with a number of people who they'll see massage people outside and they'll have their muscles worked on, they'll have acupuncture, and they'll see people who do energy work, and they'll see people who do nutrition with them. And those people, yeah, they do well, you know. So there's nothing really. I'm happy to work with most people. But usually what we recommend is that if you want us to be in contact, that's probably the best way. So if you are having acupuncture, why don't we have a conversation, make sure we're both on the same page, that we're aiming for the same thing, and then usually people's results are better that way.
So basically just make sure they communicate everything with you and you're on the same page.
Yeah. And that we're both communicating what's going on. That usually gives us the best chance of getting whoever it is in front of us to the right, like to where they need to be, really.
Yeah.
Because if for example, this is just a good example. So
yeah.
for example, if we make a correction to the top part of the neck, say on the right side, and this moves the joint to the left side, back over to the left. And what happens is that these muscles on the left-hand side, they start to fire up to hold that joint in a new position.
Mm-hmm.
If you go and see someone who then goes through the muscles and works out those muscles and releases the muscles because they're like, those muscles are tight. Then what happens is that you go, and your body that was trying to pull you and hold you over here has now been told, let's relax this off. You don't need to be tight anymore. And now you go the other way. And people are like, oh, I was feeling great. And then I had a massage and blah, blah, blah. Like, that's so it's just good. People's perspectives change. So it's just good that people can be on the same page. So I usually just say, if you are getting massage, just stick away from the neck. Let me work on your neck. Let them work on your back and your shoulders, and then we'll be good.
Great. One of the last questions we've got is around the safety question. And obviously everyone feels vulnerable around, their neck, and especially if you're dizzy. So yeah, what would you kind of reassure people on about that, about the safety of what you're doing with them?
Yeah, it's just, again, like we spoke about, it's the perspective of what's going on. So if we correct your neck, and then what happens is your head starts to come back and your curve starts to change and your neck can come back into a normal position, and you start to feel some tension in the base of your neck, people will be like, oh, look, my neck's so sore and it's so tight. Well, of course it needs to be, because those muscles that haven't been firing are now pulling you back. So it's just all about that communication with the chiropractor. And what we do is, after you've been corrected on your first days, that we call you on your second day and just make sure that you're doing okay. How did you sleep? How were things after your first correction? And just have that reassurance along the way, But in terms of safety, it's very safe. We work with people of all ages. I've worked with children of a couple of days old to people like mid-90s, and it's super safe across ages. We modify it. It's not the same, but it's quite similar for those two categories, but in the middle it's a little bit different. So we modify things based on the person in front of us. Everything's bespoke for that person. So you won't get the same correction as the person next to you or the person in a couple of hours later. Everything's tailored to you. So it's all very safe. And it's all very effective. So I know people can be scared because you're putting your health literally in someone else's hands.
Yeah.
And we're working at the top part of your neck, which is so delicate that, I understand it and I can resonate with it. And I get those questions. I had a lady email me this morning, those almost exact same questions. But it is very safe. We do all the necessary testing before anything to make sure that you're the right candidate for care, and it's safe to work with you. So you can be rest assured that we're doing things properly.
I think it's partly the cracks, not that always happens, that crack sound, but, and I think I've been told that's just gas, like escaping, like when you crack your knuckles. Is that right?
Yeah.
Obviously,
It's
think
just
of their neck as being like bent out of place.
Yeah. So as well, the work that we do is very different, and the reason it's important, this is probably a good topic, especially for on the vestibular issue, is when we make a correction in the knee chest position, So with the head turned to the side, one thing that doesn't happen is your head doesn't move. So your head doesn't spin. When you see a traditional chiropractor, one thing that'll happen is they might like twist and you'll find your head moves like this, which then can be quite like disorientating for you because your head's moved, your neck's cracked, and your vision's just swished across, and you're like, oh my days, what's just happened? Whereas what we do is we have the head still, we take a contact on the bone, and we just move that segment. So it's much more, we know exactly what we're doing. It's more calculated, and your head's not moving, your eyes aren't getting swished across. So I guess it's a little bit more comfortable because
definitely.
I never thought I'd describe a knee chest adjustment as more comfortable. But
yeah, I mean, do you have in that room did you do it on a little bench, or I don't know?
Yeah. So
what it looks like. Yeah, that's the same thing I had, I think.
The same table as Sophie's, yeah. So yeah, I've got.
It's very different from what you go in expecting, because that traditional twist,
so it's all like mid, like you can see the lump at the bottom next, so everything's really flat against the bench, and then your head stays nice and still, and then all we do is we take the contact on the side of your neck and then make the correction, but the bench is all at a certain angle with all the lumps in the right place so that it's as comfortable as possible and that your head doesn't move. So that's a key to it as well.
And you can feel or hear a crack sometimes, but that's not a worry, is it? It doesn't matter if you don't hear it either.
No, it's so like you said, that cracking and popping sound is just, if you imagine like gas releasing from the joint, like the same as if you crack your knuckles, so it's nothing to be concerned about. It's nothing to worry about. Doesn't mean anything's broken. We're not breaking anything when we do it.
Broken your neck. But you did mention as well, obviously, to be but you did mention as well to obviously be picky about who you see, and you'd need to make sure they were qualified and registered with, in this country, the GCC, isn't it? The General Chiropractic Council.
Council, yeah. So in order to call yourself a chiropractor, you need to have a degree and you need to be registered. So it's the chiropractor, because they'll come down and that's a part of being a member of the General Chiropractic Council, is that they make sure no one's going like a ringer and saying they are and they aren't. So you're pretty safe, but if you want to check, you can always check. People have different specialities as well, so it's always maybe good to call and ask the questions. Ask them if they've seen this before, if it's something they're more comfortable with, because different chiropractors will be better at dealing with different things, and it's just the nature of it, Some chiropractors work better with sports injuries, some chiropractors work better with vestibular problems. It's just how it works. You get a broad range, so it's always making sure that there's the right chiropractor for you. And if people need recommendations, then feel free to reach out to me and I can point them in the right direction.
Yeah, and what we've said about kind of keeping going, even if you're not feeling that great at the beginning, I just want to be clear for people watching, that's specific to kind of your practice and your individual communication with that person. We wouldn't just generally want people to keep going with something that wasn't, serving them, or if their chiropractor wasn't really explaining it very well, then maybe that they would be right to kind of make a switch.
Yeah, I think everything comes down to communication. So sometimes this is even more interesting bit, is that sometimes people are having a rough patch and they come in and see me and I scan them over and they look good, and I say, you guys may look great today, like we don't need to touch your neck today. If I touch you now and make a correction, you're probably going to feel even worse. And it's like, I don't get it, I feel rubbish, you don't adjust me, what's going on? And then the next day you might pull through it and you might feel fantastic, and then you might have a full week of being great, you know.
Yeah.
So that's why we don't use the symptoms. But that communication is so important on behalf, like from the chiropractor, but also as the patient, make sure that you are communicating with the chiropractor. So, because if you drop out and say, "Well, I felt worse," and the chiropractor says, "Yeah, that's fine. We expected that," then you've dropped out, and it was just a lack of communication on both sides. So, I think we try and be as upfront and communicate as much as possible, and we use our testing to be sure that everything's moving in the right direction. The chiropractors will use other tests, but just having that clear communication is key.
Thank you. I guess we'll end by I just ask if there's anything else you want to add or emphasize for people watching.
Yeah, I mean, probably one of the most common misconceptions is that when people come in and see us, it's a one-stop shop that they'll come in, get corrected once, and it'll flick the switch and everything will go back to normal. And it's just to reiterate that it is more of like, this is maybe like a lifestyle choice, you know. It's like something that it's going to take time, it takes perseverance, but given that you give it the correct time and the perseverance and let things take its course, and we'll see great changes with people. But it isn't like a flick of a switch. So it's not one adjustment is a cure all for everything. And you'll need to be checked regularly for a period of time. So it is a commitment, but if you stick to it and you see it through, then, as you know, you'll get some great results with it. And that's probably the biggest thing. People think, "Oh, I thought it was just going to be come in, get adjusted once, and everything was going to go back to normal." And unfortunately, like you said, it takes a long time to get into these situations, and sometimes it just takes a bit of time to get out of them as well. So that's probably the biggest thing for people to just realise.
Yeah. Oh, brilliant. Thank you so much. So your clinic is Top Chiropractic. Where can people find you online?
Yeah, if people want to find out more, our website is topchiropractic.co.uk. Also on Instagram, all the links are go through the website. I think our Instagram handle is Top Chiro UK. We're on Facebook, but mostly we use Instagram and our website. We upload like monthly blogs on the website across a range of different topics. Quite a few vestibular ones and a couple of Menieres ones. So if you want to check them out, they're all on there. And there's a few videos as well on there that I've done. But yeah, or you can reach out to me directly. My email is christian@topchiropractic.co.uk.
Thank you. I'll put that in the caption as well. And so if someone calls you, you said they can have a free 15-minute call with you as well, can't they, before even booking in, if they've got any questions?
Yeah, exactly. So one thing that we offer to everyone is like what we call a discovery call. And that's just for people who are maybe a little bit concerned or have questions or are unsure if it's the right fit for them, to just have a conversation with us. There's no cost, there's no strings attached. We just have the conversation. We've got them all through the week. It can be with me, or it can be with, we've got 2 chiropractors working. It will be with either myself or Elliot, depending on the time that you pick. And yeah, it's just a call. We can chat, answer any questions, and if it is the right fit, we can get the process started for you.
Amazing. Thank you so much for chatting to us. I feel like there's
You're welcome.
useful information here. I hope people will find it useful.